Now, joining us in the studio, luckily for us, interestingly, we have two doctors to help us get into health this morning. To my left, if I'm just going to start from there, I have our very first guest, Dr. Kimoni Ikutegbe. He's a consultant physician and executive director of Lily Academy and Lily Hospitals Limited. Also joining us is Dr. Precious Uduasobor. He's a specialist family physician with special interest in medicine, occupational health, and driving hyperbaric medicine at Lily Hospitals Limited, Warri. Good morning to you, gentlemen, for joining us in the studio. I'll talk to Dr. Kimoni first. Good morning to you, Doctor.
Good morning.
Many thanks for joining us this morning. And we are going to talk to Dr. Precious in a moment. But then, Dr. Kimoni, we'd like to start quickly. If we're going to look at overall health in Nigeria, the healthcare system in Nigeria, where are we? Are we making progress? Because this morning, report came in that 40,000 doctors are short of in Lagos State alone, not the entire nation. In Lagos State, about 40,000 doctors. But now, looking at the healthcare in Nigeria, are we making progress, and where are we?
We've certainly made a lot of progress. I mean, I remember when I was a youth corper, I was posted to Plateau State. There were only, if I remember, 8 doctors registered to Plateau State. So we've made many progress. When I went to medical school, I graduated in 1988. There were only a few medical schools. There are a lot more medical schools. So there are all kinds of progress. But progress is, you have to define what you mean by progress.
Right.
There are certainly a lot more hospitals. There's still no one single hospital that takes care of all your problems. If you go to many other countries, you can walk into one hospital and have all your problems sorted out, whatever it might be, head to toe. We still lack that. And then we certainly lack having all the specialties, all the specialists under one roof or one platform. So that you might say, all right, those are some of the things that hold us back. Certainly, we had a president who died of a health condition, President Yaradua. And certainly, we have had presidents fly out of the country, going out to different countries attending healthcare needs. And interestingly, there is no hospital you go to, I'm very sure, that you will not find in Nigeria, either as a nurse, physiotherapist, doctor of some sort. And it is I certainly was told that some of our presidents, when they leave here to go to other places, they take care of Nigerian doctors. So that's the problem we have. It was certainly humbling to me to find that when Mandela was ill, he never left South Africa. He was well managed in his country. I think we need to be able to do that.
Why do we still have that problem in Nigeria? That we cannot have everything treated in one center, like you mentioned, from top to bottom. Why do we still have that problem till now? When we have doctors of Nigerians, born of Nigerians now outside the country doing well and doing better, but in our country, Nigeria, we can't have that. And then this Jackpot syndrome has come in, a lot of doctors are leaving.
So it's both a problem and an asset, you could say. If you look at India, that has made significant progress, or even in China, where you have all this rapid growth, they themselves also send people out to get trained, to work outside and then come back. In India, it was this Jackpot syndrome, where Indians came. We had Indian professionals across the Nigerian landscape as teachers, professionals, specialists, and whatnot, doctors and co, who then went back to India who are now doing great things in health and brought cost of healthcare down. So I'm hopeful that in the very recent future, we'll have many Nigerian doctors coming back to set up facilities that will then do what we're worried that we don't have at the moment. Certainly, there are many organizations that are certainly building infrastructure and putting their footprints on the ground and trying to grow that. So very soon. It requires planning.
Right.
It requires a huge amount of planning. Healthcare is expensive, but training and putting things you require on ground. So it is expensive. We have a country where we have not really put all the infrastructure in place. So the kind of network you require, power, even the technical know-how to support this. I mean, the technological advances in healthcare are so formidable, and we're not able to keep up. So we need to play catch up. That requires it to be deliberate. Everybody talks about China, but there was some deliberateness around the government putting infrastructure in place to get them to where they are now, to the point where they're at the forefront of every industry. They are defining some industries, from missile technology to what everybody talks of, the car industry, you name it, even in mining. Certainly, we all hear about the China building 50,000 kilometers of high-speed rail network.
Right.
And here we are. There's not one high-speed network in Nigeria. So there's still a lot of work for us to do.
Okay, I'll come to Dr. Uduasobor now, Dr. Precious. Thank you for joining us this morning.
Morning.
And then you are a family health physician, right? And there are some who will argue that family physicians are often described as the first line of defense. I don't know if you also agree with that. But then, how important is primary health care in preventing diseases? Some will say, I am not sick, I am fine, until I'm sick before I can see a doctor. Why should you see a doctor even before you start to see signs of illnesses in your body?
So thank you very much for inviting us to this program this morning. I'm a specialist family physician with special interest in geriatric medicine.
Right.
That's care of the elderly, and I'm also an occupational health and a diving and hyperbaric physician. So as family physicians, basically what we do, we act as first-line specialist doctors who attend to patients with undifferentiated medical conditions, regardless of their sex and regardless of age.
Right.
And when I mean undifferentiated patients, it means we attend to patients with all medical conditions. So our primary health care is the responsibility of every doctor. And particularly as specialists in family medicine, we are at the forefront of it. And what this actually helps us to do is to ensure that we provide promotive services that help us prevent patients from coming down with these medical problems. One of the things we actually preach in family medicine is the 6 pillars of lifestyle medicine. And so we don't want the patients to develop these medical conditions before they even start adopting these lifestyle measures that can help them improve their health. And the question then becomes, what are the 6 pillars of lifestyle medicine? So we'll talk about the patients having, 1, physical activity. Physical activity is important because if patients actually indulge in having a highly active lifestyle, usually we say above 10,000 steps a day is considered active, and above 12,500 is considered highly active.
Okay.
Then we also talk about that, again, can be said as having activities of about exercise that will last for about at least 30 minutes a day, at least 5 days in a week. That's the recommendation. Then avoidance of risky substances use, such as you limiting alcohol consumption, staying off substance abuse, including tobacco use. Nutrition, talk about whole plant-based nutrition. People should take fruits and vegetables. Having restorative sleep of between 7 to 9 hours a day. Stress management.
How is that possible to have that number of hours of sleep with, when you look at the work, this morning we spoke about traffic, how much time people spend on the road getting to work, and then the hours they spend sitting down at work doing the job, and then getting back home, the hours they spend on the road again. How do you afford 8 to 9 hours of good sleep?
Well, the recommendation is that, the recommendation is that you should have between 7 to 9 hours. So in other words, an average of about 8 hours for you to have a restorative sleep to prevent aging and help you to, prevent you from coming down with these medical conditions. But in reality, that is not feasible, especially for low-key line of workers, because even for us as doctors, the junior doctors especially have to take calls. And so during their call period, they're probably awake all through the night. But then it's a recommendation. So what that means is that as much as you can, for every time you have the opportunity to sleep, you should utilize it. But that doesn't mean it's feasible in all sectors because of the way the economy or the current situation of the country currently lies, and then depend on the profession as well.
Okay, I'll come back to you, Dr. Precious. Dr. Kimoni, you've seen patients over the years. What's one common illness that comes, whenever it comes, you'll be like, okay, yeah, this is what it is. You've seen that occur even in young, in older generation. Over time, you've treated this same disease over time or this illness over time. How can we get out of it? But then let us know the number, the frequency of this when it comes to the hospital.
The most common illness I see is ignorance.
Okay.
That is the biggest problem here. So I'll give an example. I had a chap who worked with me. He was a pharmacist whose wife was ill. What did they do? They went to a pharmacy, they went to a lab, had some tests done, and then they chose a healthcare facility that could not manage that condition for cost. And then after staying there for about 3 days, this is real. After staying there for about 3 days and the wife was getting worse, they then chose to walk into my office. In emergency. What they could have decided at some point to have asked for advice. I'm having this problem, I'm going to do the following. Understand? And then they came in and then we started first stopping what they were doing and then doing the right thing. And then within 24, 48 hours, they are better.
Oh, wow.
So now that is some kind of ignorance. And the ignorance is about how you manage your cost. So the reason they chose to do this was they thought it would be cheaper for them to go to a lab and pharmacy than come straight to the hospital. Most of the people who come to my clinic, we have a gist, we have a laugh, we talk. We just talk about life and their health. And from there, we then decide whether there's a problem to be solved. So many times, if you leave my clinic, my room, my consult room, and you're not laughing, I feel as if I've done something wrong. We must find, even if I'm going to tell you a bad news, we must find a way to say it and laugh about it. So ignorance is the single largest disease that affects us. And ignorance, there's all kinds of surfeit of knowledge online these days, and yet people do not want to look up. You hear, the other day I had a kidney stone. And my sister, who's a graduate, I would have thought well-resourced, sent me stuff that came from social media about how coconut water, lemon, and something else, and olive oil cleared kidney stones in 48, 72 hours. And she asked me, why was I not trying it? Oh, you're too stubborn. So I asked her, did you even check if this thing worked? And so I went online and I Googled, and it was said, you could see, and then said it's been debunked. It doesn't work. All right. So unfortunately, some of us just like magic. Go to a pastor, lay your hand, and it goes away. No. Life is a system of choices. So we're talking about timing, for example. There's a lot of choice that has to be made. I remember once I was stuck in a Lekki traffic in Lagos, and a friend of mine who was in the same traffic, he left his office about 9:30, didn't get home until 1 a.m. What did he choose to do? If he slept at home and wanted to get back to work for 8, 7 o'clock, that means he would not have to leave home, get up at 4 o'clock, so he would have 3 hours of sleep. So what did the guy do? He pivoted, packed his clothes, got back into his car, and was back in his office in 25 minutes. He was at home, he was in the office about 1:30. He slept for 6 hours, 6.5 hours. Got out of his couch, had a shower, had a quick visit to the gym, and was back in office at early enough. That was a choice. Now, after that, he then decided that, so as to have time, a day or 2 days in a week, I will stay near my office. So he found somebody who had a room in his office. So, so as to save time, he would choose to stay with a friend. So he walked from the office. His car is parked in his car park. Walks to his office to his friend's place, have dinner, have an early night, and catch up on his sleep. But also have time to do some homework before going to bed. Because he didn't have to spend 4 hours in traffic. So instead of that 4 hours, he'll have it with a meal and then go to bed early. So there are all kinds of choices. Health is a choice.
Right.
Health is always a choice. And I could choose to have ice cream every day. All right? It has some, listen, I could choose to be, the other day I saw somebody who had an accident, who somebody hit. And he got out of the car, was getting a physical altercation with somebody who you don't know what the problem is. that guy hits you in the wrong place or pushes you across and you fall badly, you are invalid for life, disabled for life. Those are choices. So control yourself. It's largely about making certain choices. You are healthy by what you do every day. Who you talk to, how you talk, who you sleep with. I'm talking about when you get home.
Right.
Do you have a conversation? So there are all kinds of problems. I get home and I choose to say, all right, I'm going to have that just happened, but I'm going to deal with it. Let's have a meal. Let's have a meal in some sensible conversation and be genuinely caring about each other. That gives you a 5, 10 minutes, 15 minutes, 30 minutes break. You've unwinded.
But then we've seen increasing stories about or healthcare concern recently: hypertension, diabetes, kidney. You spoke about kidney stone, right? That you had and you got information and all. Why do we have this increasing trend of these illnesses in Nigeria?
There are many reasons for this. There are many reasons for this. But the thing is that, all right, we're all born with a certain series of whatever. That's your genetic, your biological makeup. Then you can make some choices. Despite what's going on with me, you have to go check yourself up.
How often should you do this?
So I remember being a young child, and I was having to be vaccinated as a child. I remember getting I think it was chickenpox vaccine in my primary school, and they would come around to vaccinate us to make sure we all got vaccinated. I don't think that those kinds of things happen any longer. So there was a general attempt by government at the time to make sure all kids were vaccinated. These days, there are still that, but your parents will take you to vaccination.
Do you think government is doing enough?
Government can only do a lot more. Government's trying to contend with too many things, but I think we're distracted. I don't think government is doing all the right things. They can always do better. If you don't raise the bar, even if you're doing well, if you don't raise the bar, how do you improve? But also, we who are the citizens must also know what we need to do.
Right.
Even choices of food. Suddenly, what we thought was healthy is no longer healthy. People are now eating all kinds of things, wheat. And all kinds of suddenly noodles and spaghetti.
We're really pressed for time, Dr. Kimoni.
Yes.
I'll come to Dr. Uduasobor Precious now. Practical 3 habits that we can adopt in Nigeria. Practical ones. I know you mentioned good sleep. Some people can afford good sleep up to an hour because of what they do. They need to make money. But 3 practical health habits that we could adopt that could help us live longer. Because life expectancy right now, they say, is below 60 years in Nigeria.
Never been above. The last ahead of it was it 56.2 years or so, or thereabout.
Right,
so,
about 56 years now.
Exactly.
So what can we do? Practical health, very practical.
Yeah, so one of the things we can do is actually to increase our activity levels. So you wake up in the morning, you can brisk walk.
Okay.
Or just get a phone that has an app on it that tells you how many steps you make in a day.
That's one.
And we said greater than 10,000 steps. That's active.
All right.
Then 2, limit alcohol intake.
Okay.
Avoid tobacco.
Okay.
Avoid substance use, cocaine, heroin, and all that. Tramadol, which is very common in our age group.
Okay, that's 2. Number 3.
Codeine containing cough syrups. So that's part of it. And then also ensure positive social connections.
Okay.
So build strong and loving relationships with families, friends, and communities.
All right.
Positive social connections.
All right. All right. We're totally out of time. I wish we could have this conversation on and on, but the news is top of the hour, 9 a.m. And I want to say a very big thank you to Dr. Kimoni and Dr. Precious Uduasobor for your time on the program this morning.